Okay, welcome everyone. Thank you so much for joining us today, especially when the weather's so nice outside. We're going to be talking today about potential careers in medicine and healthcare and how you get there. We've got a great program lined up for you. First, we're going to hear from two academics from the University of Bradford. They're going to talk to you about some areas of medicine you may or may not be familiar with. For some of you, it may be the reason you're joining us, and for some of you, you might be learning some new information. So we're going to hear first about diagnostic radiography and then paramedic science. And then we're going to have a discussion with our students that we've got joining us today. We've got some medical students. We've also got a nursing student and a physiotherapy student. And they're going to be talking to you a little bit about their challenges and their highlights and some pro tips for those of you who are looking to study medicine and healthcare. And then we'll hear from the medical students about the kind of stressful process of applying for medical school and get their top tips about that. And then also hear from the academics about what they look for in an application. Then you'll all have a chance to talk to the entire panel. Any questions that you want to ask, please feel free to put them as we go along into the Q&A. My colleague Esther is going to be monitoring the chat the whole time. Esther, do you want to just say how that will work?
Yes. Put your questions in. I think it might get a little bit confusing because everyone's somehow logged in as the same person. So I think that's just a link issue. So apologies for that. But just put your questions in and I'll respond as we go in the Q&A.
Fantastic. Thank you. Okay, let's not waste any time. Let's hand over to David.
So hi everyone, I will be sharing my screen.
Oh, Dave, I've done it for you.
Oh, okay, excellent. Brilliant. So hi everyone, my name is David Omi. I'm a diagnostic radiographer, and I'll be talking to you about careers in diagnostic radiography. Just move to the next slide. So this is me, David Omi. My current role, I started at University of Bradford was in 2020, and I have experience in what we call magnetic resonance imaging, computed tomography. I've worked in industry, I've worked abroad, and the two pictures you see there, one is my wife and one is my mom, who are both diagnostic radiographers. So I have diagnostic radiography in my blood. I'm excited about the profession. So the first question is, what is diagnostic radiography? I put it out there. Diagnostic radiography is a healthcare profession that specializes in using imaging modalities to diagnose and treat medical conditions. Diagnostic radiography plays a vital role in various medical procedures by creating internal images of the body. So more or less, we call ourselves the eye of medicine, okay, in diagnostic radiography. Next slide. So if you see this slide here, diagnostic radiography is the art, is also a science of using different imaging modalities for diagnosis and treatment. If you see the images with the alphabets, we have different imaging modalities there, and the images with the numbers are images that are produced by the different imaging modalities. So in diagnostic radiography, we have different imaging modalities. These are just a few of them. There's a CT scanner there, which is alphabet C. There's an MRI scanner there, which is alphabet A. There's an ultrasound there, which is alphabet B. And there's an X-ray equipment there, which is alphabet D. There are just a few of the imaging modalities we use in diagnostic radiography. If you see the numbers on the other side, the first one is an MRI of the wrist. The second one is an ultrasound of a fetus in the womb. The third is an X-ray of the elbow. And the fourth is a CT scan of the brain. Okay, so that's exactly what we do in diagnostic radiography. We use different imaging modalities for diagnosis and treatment. Next slide, please. So there are questions we need to ask ourselves. The first question is diagnostic radiography for you? And you have to be sincere about your answer. Do you like working in hospitals? That's a good question you need to ask yourself. You will agree with me that the hospital setting is quite different from a mall. It's quite different from a university setting. It's quite different from somewhere else where you go and, have your kids and play with them. So do you like working in the hospital? Do you have interest in technology? All those imaging modalities you saw, they're all technology oriented. So you must have interest in technology. Do you have a caring personality? You have to care for patients. You have different conditions and different kinds of patients who you have to care for. So you have to have that caring personality. You have to have good interpersonal skills. These are questions you need to ask. You're not going to be working in isolation. You're going to be working with a multidisciplinary team, working with different people. You're going to work with porters. You're going to work with carers. You're going to work with nurses. You're going to work with surgeons. So you have to have good interpersonal skills. You are going to work on social hours. Midnight, you might have to work on Christmas Day, on Eid Day. You might have to work on New Year Day. You might have to work at odd hours. So these are some things you need to think about. And it's a longer academic year. Why do I say that? Sometimes in summer, you have placements that you need to go on during summer when other professions are on holiday. So these are some of the questions you need to think about. Next slide. So what are the university expectations? It's a 3-year academic study. We have what we call continuous assessments all through the semesters. You might need to travel for clinical placement hours. You need to think of the cost implications. We have varied assessment strategies. We also have different learning methods in teaching our students. So what are the skills required? I've highlighted some of them before. Good communication skills is key. You need to be able to communicate clearly with your patient because of patient safety. You need to have that caring disposition, which I've highlighted. You need to have good observational skills. Some patients come in, they look well, but if you observe clearly, they might have some underlying conditions which your observational skills will help you. You need to remain calm under pressure. Sometimes you have patients from the A&E who come into the department and you need to work under that pressure. You need to be able to prioritize. You need to have good decision and organizational skills. When they come under pressure, you should be able to make quick decisions, and you also need to be analytical. We deal with a lot of images, so you need to be analytical. Next slide, please. So these are different specialties in diagnostic radiography. You can't get bored in diagnostic radiography. You have computed tomography. I have specialty in MRI, which is there. We have the DEXA, which is the dual energy X-ray absorption, which checks the bone density. We have the nuclear imaging. We have interventional. We have MRI, which uses magnetic waves to scan different parts of the body. We have the mammograms, which takes images of the breast. We have the ultrasound for scanning different parts of the body. And since we deal with different images, we also have the image interpretation. Next slide. So these are just things that we do. We check if the images are normal. If the images are abnormal, the image to my own right is an abnormal. If you look towards the bones area, there are broken bones there. These are some of the things we look out for, whether images are normal or abnormal. For the next one, we also identify objects and locations. Sometimes we're looking for pathologies, we're looking for abnormalities. If you look at this, we need to know where there's a key there. Yes, it might not be a key, but we might be looking for an abnormality. This is within the abdominal region. If you look at the hand there, there is also a nail there. Next slide. So what are the work opportunities? There are so many work opportunities as a diagnostic radiographer. You can work in clinicals. I've worked in clinicals. You can work in research. I've worked in research. You can work in teaching and education, which I've worked in. You can work in industry. I've worked in industry. I've worked in a sales manufacturing company who makes some of these high-tech equipments that we use. I did clinical education for them, training them on how best to use MRI. You could have leadership positions. We have radiographers who are in top leadership positions and politics. We have technology-enhanced practice. AI is in vogue now, and radiography is leading in AI because of the technology involved. We have veterinary part, forensic, quality assurance, biomedical sciences, some of these equipment. Some people go into the engineering part and try to fix some of these equipment as a career. Next slide. So at University of Bradford, we have varied on-campus simulation equipment, which we use to teach our students. And one is, we have 2 X-ray suits. All these are at University of Bradford. Simulation is simply trying to simulate what happens in clinical placement. So we have all this for you at the university. Next slide, please. And this is our VR, virtual reality. We also have this on campus. So students have access to the VR suite on campus, and they also have a desktop version. In the VR, you are immersed into an X-ray room where you can practice your radiographic skills. Next slide, please. So all these are available for student support, academic skills, clinical teacher support. We have NHS bursary for radiography students, and you could have opportunities to have placements abroad. And I think we're wrapping up. And the next slide is just the application process, which we'll talk about towards the end when it's time for question and answer. Next slide. And this is our beautiful university campus. And I won't leave without talking about our university campus. And these are also our beautiful University of Bradford environment. So thank you very much.
Thank you so much, David. We're now going to hear from Andrew. Let me just make sure that I've got your slides up for you. Here you go, Andrew.
Hi, yes, I'm Andy. I've been a paramedic since 2005, still am, do shifts on the road. So yeah, I'm just going to talk to you a little bit about a career being a paramedic. I don't have quite the impressive slides, unfortunately, that David had. He's certainly outdone me on the slides, but I will. I'll go through step by step how to become a paramedic and what we do day to day, and obviously when we get to the end, we can go through the sort of question and answers as well. So paramedics, when I joined, it was very much a vocational career. I joined and did a 7-week course to be a paramedic, and we used to work on ambulances as paramedics still do now, and we used to go out to emergencies. Most people would end up at the hospital, so a large part of our day-to-day working was going out and seeing different people with different emergencies and taking them to hospital. So doing a vocational style 7-week course was perfectly well and good for that. In the last 10 years, certainly from 2013 onwards, the baseline requirement for being a paramedic has been a degree. And that's simply because the job has become progressively more and more complex and more, I would definitely say, interesting. We go to very much the same patients now. Paramedics still work on ambulances. We go to the same patients, but we deal with them in a variety of different ways. That's probably a necessity because of the sort of, as you'll hear in the news, the sort of busyness of the healthcare setting and the world now. So we do treat a lot more patients in the community off our own bat now, and for that, obviously, we need a better understanding of the medical processes and what can be wrong with patients. So if you bob onto the next slide. Okay, so it is, I'd definitely say it's really has been an exciting and a very rewarding career. Okay, we specialise in pre-hospital care. So by specialising, I mean pre-hospital care is now a subdivision of the healthcare environment. Doctors, paramedics, nurses, and a whole wide range of professionals now specialise pre-hospitally. Requirements pre-hospital are a lot different, so you need to be more adaptable. We work in what we call uncontrolled environments. So we go into the environment and we have to assess it for safety, make the environment safe, okay, and try and work within an environment where it may be outdoors, it may start raining, there may be traffic on a road that's going past, and we have to work and cope with that. It's not the controlled environment that you'd sort of find in the hospital. We work in what we call a resource poor environment or an austere environment. So we have to learn how to adapt and do our best in those places for the patient, and effectively take the medical equipment and medicine and the knowledge that we've got to the patient rather than the patient presenting at the hospital. In order to do our best, we work unsocial hours, so we work 24/7, as I'm sure most people are aware. If you sign up to become a paramedic, you don't lose your social life completely, but it does take something of a hit. But I do think the rewards that you get from doing that really outweigh the downsides of that. Okay, We work on what we call undifferentiated cases. So the cases we go to are just anyone that rings in with anything wrong with them. So you could start your working day, you could check you've got all the equipment on the vehicle, and you go out and you won't know what the first job is until it appears on the screen. And the challenge of being a paramedic is being able to understand what's coming down on the screen, get to the job, drive safely with blue lights. Oh, just knock back a slide. Sorry, where are we? Slide number 2. Yeah, sorry. So we'd arrive on the job. We meet the patient, we ask the patient questions, try and work out what's wrong with them, and try and work out what the best thing to do is for that patient. So sometimes that might be to take them to hospital. Other times that might be recommend that a GP come out and see them. Other times that might be, if you develop and become a specialist paramedic, that might be that you're able to prescribe them or give them some medication yourself, or you may be able to refer them to other areas of healthcare. And the bullet points that you see there, really, that could be from the start of your working day. That could be 4 different areas of jobs that you could get one after another. So the first job you could go to on the day could be somebody that's fallen off a horse and broken their leg. You could take that person to hospital, and then you might go to somebody that's having a severe asthma attack. You're able to relieve the asthma attack, take them into hospital, let them see a doctor. You then may go to somebody with that's having a mental health crisis, and hospital may not be the most appropriate person, most appropriate place for that person to be seen. So you may refer that person on to a mental health nurse, or the mental health team, or the crisis team, or someone within the community. Your 4th job, it might be the last job of your day. You might go to, typically the social care revolves around sort of the elderly population. So you might go to somebody who's got nobody else that can help them. Nobody comes in, helps look after them, and they can't get around their own house. So you might go to that job and decide that that person might need a referral further into the social care system, and you'll be instrumental in setting up and getting people the right care for meeting their needs. Okay, it's safe to say that no 2 days are the same. The classic thing that we do see in the interview sort of setting when we're recruiting for paramedics is that people say they enjoy jobs where no 2 days are the same, and the paramedic job is definitely from experience that kind of job. Where can your career take you? Well, within the ambulance service, we've got specialist paramedics now in critical care and urgent care. So critical care being cardiac arrest type jobs, the severe medical cases, RTCs where there's significant injuries, that kind of thing. Urgent care is more along the lines of minor cuts and scrapes, illnesses such as infections, urinary tract infections, chest infections. Urgent care specialist paramedics can give antibiotics, steroids, and that kind of thing to help people in the community. HEMS and heart. So HEMS is the helicopter emergency medical service. And the heart team, you may have seen on TV, are the hazardous area response team. And they're paramedics that like to sort of specialise in either one of those directions. Heart tend to be what you'd associate with major incidents and factory sort of gas explosions, or if something's gone wrong on top of a crane, they've got the kit to be able to go up there and take medicine to the patient that way. With further education, and you'll see from the framework that I've got on the right hand side, we're generally looking the sort of 4 pillars that you've got around this circle for career progression. And you can see that throughout your career, you might move from being a paramedic to being a specialist to being an advanced paramedic. And along that, you'd start off with a BSc, which would be your basic paramedic qualification. To move to be a specialist paramedic, you might undertake some postgrad. And then to become an advanced paramedic, you might have to do a master's. You can then become a consultant paramedic, depending where you go. You could become a university lecturer or professor. And that's how that works, really. And the list there is sort of self-explanatory and completely not exhaustive. People work in all kinds of settings, and we have even had people in the past that have gone on to become doctors. And I think the final question, how do I become a paramedic? So looking at Bradford, we run a 4-year course. So our course is unique in the fact that it gives you a sandwich year. You spend your 3rd year at university as a member of qualified ambulance staff below the level of paramedic. You work in that for 12 months, and that supplements the sort of university education that we give you, and you learn to work on an ambulance. All of the university courses that will teach you to become a paramedic will teach you in 3 years. You'll come out of university with a paramedic qualification, which is great. And then you will have to learn how to work on your own, being responsible for all the decisions and having your own autonomy. If you come to Bradford, we will teach you how to become initially what they call an ambulance practitioner. You will work within practice with university input as a paid place with the ambulance service for 12 months, learning how to make those kind of clinical decisions and how the ambulance service works. You then come back to university for a 4th year, finish off everything, and then qualify as a paramedic with a blue light driving qualification and all the experience that you've taken through sandwich year. Okay. For any paramedic qualification you do in the country, you get a bursary that's paid in 3 installments every year that you're a student, and they're just below are our entry requirements. I think that's about all I've got. I hope I haven't run on too much.
Thank you so much. So interesting. Okay, thank you. I have personally benefited from both of those areas of medicine, so it's very interesting to hear how people train for them. Let's now meet our students. So we can ask you to turn your cameras on. And can you, first of all, introduce yourselves, where you're studying, what you're studying, and whereabouts in your studies you are? And I'm going to start just how it looks on my screen. So Devanshi, let's start with you.
Thank you. So, hi everyone. My name is Devanshi Sharma. I am a student nurse at University of Roehampton, and my area of specialization is adult. As many of you must know that there are 4 different types of nursing you can do: adult, child, mental health, or learning disability. I am towards the end of my first year. This is my last week, and then I'm done with my first year.
Great, thank you. And Georgie?
Hi everyone, I'm Georgie. I'm from Brighton, Sussex Medical School. I'm a medical student. Yeah, I can't remember what the other thing was. But I'm at the end of my first year. I've just finished my exams for my first year.
Fantastic, thank you. And Rishika?
Hi, I'm Rishika. I've just finished 2nd year of physio. We finished 2 weeks ago. I study at St Mary's University, Twickenham.
Great, thank you. And Elsie?
Hello, I'm Elsie. I go to Brighton and Sussex with Georgie. We're both end of first year, finished our exams, 2 weeks ago as well.
Okay, I'm hoping that you all did really well in your exams and you're feeling good, yeah? Okay, good. Tell us what motivated you to study the particular area of medicine that you're interested in.
Is that for us?
That's for you. That's for all of you.
Okay, for me personally, I have always wanted to be a doctor, and it's something that has been in my life for a long time. Neither of my parents are doctors, but just sort of, I love the idea of working with people and having a different, experience every single day, and being challenged academically. And yeah, for me, I felt that medicine was the right path because I really do like the sort of nitty-gritty science, bit of a nerd really. But yeah, for me, medicine is, I absolutely love it. Definitely the right course for me.
Thank you.
Yeah, I think my answer is quite similar. I always thought you had to have like a really unique or exciting story as to why you wanted to do medicine. But like genuinely for me, it just comes down to being able to help people and work with and for them at the same time. And I always wanted to be a doctor, but I also know people that decided it a year before they applied. And like, if you want to do it, it really shines through. And you do, if you go through work experience and volunteering, which I did, just being able to communicate with people and just like see what differences can be made, it just kind of, it all came together for me. And I was like, this is definitely what I want to do.
Thank you.
I was actually, it was quite different for me. I didn't know what to do at uni. I was like, okay, right, so what do I do? So it was quite like, because when you're in college, you're like, everyone's deciding and what everything wants to do, and it can be quite like overwhelming. But I didn't decide until kind of beginning of year 13 what I wanted to do. And within physio, so I do physio, so what interests me is kind of you build like long-term relationship with patients. You're with them for quite a while, depending on what area you go in and the impact you have, depending on what area you go in. It's quite like satisfying. And also the fact that you can do so many, so there's like sports, you can do neuro, you can do respiratory physio, and there's loads of areas you can do, and you can get quite good work-life balance. Physio is an area where you can have a good work-life balance within healthcare.
Thank you.
For me also, I wasn't really sure what area I want to go into. So when I looked up, but I didn't want to go into medicine, but I enjoyed studying biology and I wanted to work in a medical field. So I went for nursing because I realized that with my nursing degree, I wouldn't really necessarily have to work on board. I can go into research afterwards or teaching, or so there are number of opportunities I can take up afterwards, or I can specialize in any area I like and be a specialized nurse like infection control nurse or dementia nurse. So that's what appealed to me in nursing.
Great, thank you. Same order, I think that worked. Let's talk about what have been your greatest challenges so far.
The application process for medicine is really rough. I'll be honest. It's a marathon, but you feel like you're sprinting. The thing is that it will just test you, and it will test you'll test your commitment. Because you will sort of figure out where you want to apply, and that's very difficult, and then you will do the exams to get in, and that's very difficult, and then you've got your A levels to manage, and then interviews, and it's really, really intense. And so that is without a doubt trying to juggle. I used to say all the time, A levels aren't that hard when you're just doing A levels, and I definitely felt like that in year 12, and then I got to year 13 and it was very different, and I just felt like I was not enough hours in the day to get everything that I needed to do done. And that, like, year 13 is really, really difficult, and that's how I felt about it. And I think that Elsie will probably agree. However, you get through it, and you realize, and you remind yourself that actually this is temporary, and I have not felt at once in all of first year how I felt in year 13 at a lot of points, but it just kind of tests your commitment, really. But I mean, it never really wavered for me, so it's all worth it in the end. But it's especially the exams, the UCAT and the BMAT. I mean, obviously I think this is the last year of BMAT, but it's a long slog.
Thank you for that. I think that'll be good for students to hear that maybe year 13 might be actually worse than their first year of medical studies. Thank you for that. Okay, Elsie.
Yeah, I mean, I can only agree with Georgie, to be honest. The application process is a little bit grueling. I think the bit that I found hardest about it was just the uncertainty that was around it. I mean, like with UCAT and BMAT, the questions change every year, and there are ways to revise, but it's just difficult. Do you know what I mean? Like you can't, and especially with UCAT, because it's randomized questions and it's so quick, it's just the day is the decider at the end of it. Like you can revise, but when it comes down to it, you just have to have that belief in yourself and that kind of ability to kind of say to yourself, I've done everything I can and I'm going to do this, and I can deal with whatever the outcome is. And like that uncertainty, I think, is there throughout the entire process, because interviews, they are genuinely what you get on the day is what you get on the day. There's no structure to a lot of them. Like you can be asked anything. And I think, like, even for me in year 13 is definitely the hardest part of it, I think. And just the kind of, I never believed anyone when anyone said, you're going to be fine, and like the interviews will be okay, and the UCAT and A levels will be okay. I just remember sat there and kind of stressing about it the entire time, because I was just so unsure of what was going on. But genuinely, like Georgie said, it really tests your passion for it. But when it's there, it's there, and you have so much to look forward to when you get to medical school. And the first year of medical school has genuinely been like the best year of my life, because it's so much fun once you get here. So you just kind of have to keep pushing when you're doing it.
Great, thank you. And Rishika, biggest challenges?
So I mean, the application process, it's less complicated than medicine. All you do is you kind of do a personal statement, you send it off, but there are interviews you get through the interviews like they did mention with medicine, and it's much easier. I think the interviews kind of with medicine, I think you have more like different styles, but different unis do different styles of this. So there's like MMI, which is like loads of different stations, and there's like in general interviews. And then so now kind of I'm finished second year. First year is definitely, I would say, kind of doing the course is much harder than the A-level process. Year 12 and 13, it was much harder, especially like first semester, where you're going through all of anatomy and all of the content, so you can do those placements in second year and third year. And so we've just done 2 placements this year, and I would say like the hardest part was just like going out on my first placement first day, and I was like, what am I doing here? Like I don't know what anything that's like happening. It's like you're at a hospital and you're just expected to do different things, and depending on your educator, you get really good support, and depending on the hospital, which really helps. And it's your first day and they expect you to know what you know, and you do get that support from your uni or from your educator, so that generally helps as well.
Thank you, good perspective. Devanshi?
Similarly, for me also, the application process went smoothly. I had my A levels and then interview process and all that. But being at the uni and managing everything, placements, academic pressure, if you work, then your work life, your personal life together, I didn't knew it would be so challenging. But as long as you stay organized, it's okay, it's doable. Other than that, I never realized that when I go into clinical placements, it can be emotionally straining, because you form bonds with your patient, and if you see them suffer, or sometimes you lose patient, and at the end of this, sometimes you feel it's sometimes emotionally straining. But again, the support is always available, and the good part of it is when somebody feels better because of you, you feel fulfilled as well. So yeah, it's been an
Great,
incredible journey so far.
thank you. Really honest perspectives as well. I think it's important for people to know what they're going into. Let's talk about highlights. What have been your highlights so far?
Well, for me, it's got to be the fact that with the medical school that we go to Brighton and Sussex Medical School, we get to do dissection. And so for anyone that's not aware, these people donate their body before they die, and then we dissect their body. And we sort of go as we go along through the course, and we learn about different things in different systems. We started with cardio and resp, and then we did GI. And you sort of dissect those parts of the body. And for me, that has just been brilliant. I love DR. I know it sounds really odd, and some people, will always hate it, and some people will be surprised how much they love it. But I just think I love the practical, and I love learning practically and being able to see and touch and feel. And the facilitators that we have are excellent. And I love anatomy. And it's really sort of, for me, it sort of made me look at, the Surgical Society, and sort of getting involved with that, and it opened that door for me, because I realized, actually, I think I'd quite like to look into surgery, and it could be a path for me later on. But yeah, I mean, I think also, like I say, societies, the Surgical Society, I ran an anatomy revision session for my year group, which was a bit terrifying, because you are, at the end of the day, doing a revision session for a bunch of medical students. Even if you are one yourself, you sort of have to remind yourself that you actually can do this. Yeah, that would also be a highlight, is just societies. That's one big thing I'd say to people when you go to uni. On Freshers Fair, sign up to everything, follow everyone on Instagram, get in all the WhatsApp groups, and then if you don't want to go, don't. And if you don't enjoy it, if you go once and you don't enjoy it, don't go again. But it's brilliant, and you will network, and you'll meet some brilliant people, and you will meet 5th years and 4th years that have so much knowledge and wisdom to give you. So sorry, I've spoken for quite a while, but yeah.
That's great advice. No, thank you. Elsie, what about you?
I find this question really hard because I just genuinely have loved first year, but I think I'd have to say that the placements that we've been able to do this year are genuinely just some of the most like amazing experiences. I was really lucky we got to do an A&E placement this year. It was quite a short one, but the doctor that I had taking me around A&E was amazing. Kind of just really got us stuck into what A&E is like, which I mean everyone knows it's just really hectic and like no one really knows what's going on. But it was, and I mean I was definitely annoying all the doctors and nurses around me because as a first year I don't know anything. But it was kind of like they kind of just give you permission and they watch over you and you feel very secure in what you're doing. Not that you know very much, but I got to speak to patients and I got to actually genuinely like practice what we'd been learning, like taking histories and being able to ask them about their experiences. And I got to do that as well in GP placements that we had two of throughout the year. And it just felt like such a privilege to be able to sit in and listen to people's lives and what they're experiencing and be able to see the people around me using knowledge that I was learning to actually help them. Like it was really kind of surreal the first time because it was just like when as I move through this, I can help people and I can actually use what I'm learning for good.
That's amazing. It just shows as well that you are absolutely natural medical students because you both just described things as highlights that I would find personally very daunting. That's amazing. Rishika, what about you? What's been your highlight?
I mean, in terms of like uni in general, it's definitely like Georgie said, just joining societies and like meeting new people, that's been amazing. And just like join as many as you can and you'll meet loads of people. In terms of my course, it's like, you know, first year's a lot of theory, which is really hard to get through. You're like, oh, you know, what am I doing here? Like, I don't know what if this is for me. But once you're out on placement, you see what it actually is. It's like, it's so much more rewarding. And when you see patients, so I was recently on musculoskeletal patients, so placement. So there's loads of like back pains and knee pains in general, body pain. So it's kind of nice when they come back and they're like, oh, this is better, or like, you know, they send those nice emails sometimes, which as a student, they know you're a student, so like sometimes you get that more rather than when you start working. So it's really nice to know, oh, like, you know, what I'm doing is actually helping them, because as a student sometimes you can like kind of have like imposter syndrome. You're like, oh, like, you know, am I doing this correctly, or like, am I supposed to be here, or like kind of, oh, I don't know really what I'm doing, I'm just going to try this out and see where it goes. And sometimes it is like that, you know, you don't necessarily know everything and you can't figure out everything in one go, and you just have to see where it goes. And it's really nice to know that you are doing the right thing, and that's been the most rewarding bit, I'd say.
Great, thank you. And Devanshi?
So I would also say the clinical placements, I've been to 2 placements till now, and both have been incredible and different in their own ways. I went to a neuro ward for 6 weeks and I enjoyed it. Then I went to an acute assessment unit for 7 weeks and I absolutely loved that as well. It's more fast paced and I like that a bit more. But you actually, so when you go on placement, you actually get hands-on experience on what all you have been learning, all the theoretical knowledge, all the skills, and you get feedback from patients, from your supervisor and everything. And I would say that's the highlight for me, so that you can reflect and work towards it.
Amazing. Very impressed with all of you.
We had a question, Justine, sorry, on the chat, and I thought it'd be quite good to ask the group, because I think we haven't scared people, but they said year 13 seems so difficult. If I don't manage to get through, what other options are there, basically, instead of medicine?
Okay. So, guys, what would you have done if you hadn't got through in year 13?
I would have applied again. I would have applied again and again and again until I got in. And I know that a lot of people say that and it sounds like rubbish, but for me, that was that like I kind of know that this is the only thing I want to do, and that if I did anything else, I would just be asking myself, what if, forever. I know, and you know, Elsie and I know of people who have taken many gap years. We have many mature students in our year, and that's very common in medical degrees. I'm not sure about physio and nursing, but I know that in medicine it's very, very common. And it's never too late to start. And you know, sort of and I know that it is daunting and it's also expensive and it's complex, but I think if you really know that it's what you want to do it and stick at it, because you know it's when you've got loads of doors slammed in your face, you just have to open one, and you know you never know what's on the other side. Yeah.
Did it occur to either of you, would it have occurred to either of you to go the biomedical science route, which has lower grade boundaries that you can convert later to medicine, or do you just know, no, I want to be a medical student and I would hold out for that?
I looked at a couple biomed open days when I was doing open days for medicine, because I was aware of the fact that it is quite difficult to get in, and there was a chance that I wouldn't, and that biomed would be an option. The bit that put me off biomed going into medicine, I think, was the graduate. When you do biomed, you either have to do the entire course and then reapply to medicine, or you can get in, I think, from the first, I might be wrong, but the first year of the course you can then transfer to medicine, but that's like a graduate entry thing, and that's actually more competitive than it is just to get into medicine from the get-go. And I think it's one of those things that you know yourself and you know what you want to do. There are so many options there, and there are so many careers in medicine, and if you do decide that, you know, I'll take a year out and I'll do maybe something else, and then if I come back and I am still so set on this, then you can do it at any age and any point of your life. Do you know what I mean? And it's like, but I remember saying to my parents before results day, I was like, if I don't get the grades that I need right now, I'm not going to uni. I'm taking a gap year and I'm going to do it again, because it was just like, that's what I wanted to do. And I think when you're in that position and you can talk to people around you about it, you do find a way, you do kind of find your way through it and figure out what it is you want to do depending on the outcome.
So our next question was going to be, but we can weave into this with all four of you. What do you know now that you wish you'd known in sixth form? So maybe you kind of weave into your answers, you know, some tips for being successful in sixth form, so that you're not in that position where you have to think, what else would I do? Georgia, let's start with you and we'll go around all four of you.
Well, I mean, in terms of the things that I wish I'd known, I'm going to push this so many times every time I speak, the importance of the UCAT. I cannot stress this enough, because nobody really made this clear to me. The UCAT is not something that you do to tick a box. The UCAT is the way that you get in. It's the way that you get your foot in the door. And I cannot reiterate that strongly enough, because and I say UCAT because they're discontinuing BMAT, but that also goes to BMAT, because we go to a BMAT uni. And it is so important to work at that, and you will have to put a lot of time into that and a lot of hours into that. And I think, and also I wish that I'd known that how long the process feels. You know, you sort of think, okay, well, you know, it's you know, October and I'm applying, and you know, I'll know by in your mind. I was kind of like, oh, I don't, maybe this was just me. I thought I'd know within a couple of months, you know, sort of Christmas time. You won't. You're looking at sort of March, April, and that feels very long, especially when you're literally checking your emails every single day, hoping for the best. But yeah, it's a long slog, and it feels like it, and that's what I'd say.
Thank you. Elsie?
I think it's difficult because there are so many different kind of parts to the application process, but I think what I wish I'd known is just to try and focus, because it's so much of it is in other people's hands, just to try and focus on what you can control. You've got control over what you do in terms of UCAT revision and BMAT revision and things like that, and you know what works for you. Like, you can watch videos on YouTube that are like, you should revise this section and this section, but if you've got one bit that you know you're worse on, you can control that. You can work on that and work on that and work on that. And it's the same thing with interviews and A-levels. Do your best and let what happens happen, because you can't control the questions you're going to get on the day, but you can control how you're feeling before the exam and how prepared you feel for the exam. Like, you're never going to get in and be like, oh, I'm 100% going to ace this, like it's going to be amazing. But you can say that to yourself, you know, I've been consistent with my revision, and I've tried my best, and I want to do this, and you know, it's out of my hands at that point. And I think you have to be able to kind of give yourself those little pushes throughout the process, because it is so long.
Yeah, good advice. Thank you. Rishika, what about you?
I would say in general with the application process is kind of with physio, it's like, you know, get your work experience and get your it's what sets, you know, everyone's gonna have the grades, or everyone's gonna have the predicted grade. Most people are gonna have that, but your past statement of what you have, what else you can bring, is what's gonna set you apart from the others. And for me, I applied during COVID, so work experience was actually really, really difficult. So I did, you know, I had to look at loads of like online resources and online kind of things that I attended, or online work experiences you could get at the time, or volunteering. So I had done like DOV, so I did volunteering a part of that. So things you can within healthcare, things that show that you like different aspects that you look in healthcare, such as like caring, or like, you know, you're taking out time for something to help out the community, such as volunteering. These things like really set you apart, and like mentioning this in your personal statement is going to be really helpful. But it was also quite difficult for me, because I decided quite late that I wanted to do physio. It was kind of beginning of year 13, so I had to gather like all the work experience I can in that short period. But it is possible, like, you know, if you really want to do it, you will kind of find a way.
Thank you. It's good to know as well, I guess, for people who are deciding kind of a bit later, they might feel like they're playing catch up. It's good to see that you can do it if you're determined. So thank you for that. Devanshi, what do you wish you'd known?
I wished I had known that it's all worth it. At the end, when you get in and everything is going good, it's all worth it. You don't even remember how much hard you worked and all that. It's So I would just say be positive, keep going, just work hard, because at the end it's gonna be worth it. I am so glad that I didn't stop. I just worked hard. I researched all my options, and I was sure that yes, I want to do nursing. It's very important that you know what you're getting into, and you have your own reasons, because you need passion for this kind of profession. To go into medical field, you need to have passion, because I see so many people who start and then they fall out of it. So if you should research all your options, and if you are sure that you want to get into it, then only go for it.
Brilliant. Thank you so much. Okay, so I'm going to talk a bit more in depth now with Elsie and Georgie, for those of you that are interested in medical school, because it is such a stressful process and so difficult. And I know from talking to many students that it's something that people worry about. Talk us through that, guys. What are your kind of top tips for applying for medical school?
I think there's there's quite a lot to kind of focus on. I know Georgie's going to talk about kind of strategic applying, and that is, when she talks about that, that is such an important part of it, because there's so many options and there's so many things out there, but you just have to kind of really look at what you're applying for. But I think, because one thing that I found really difficult was the interview process, because I did 4 interviews and I did loads of different styles of interviews. Like I had role plays, I had a panel interview, I had MMIs that were mentioned earlier, and I think I was really focused on looking through all of the most common interview questions and thinking, right, do I have an answer for this? Do I have an answer for that? And I got asked, I can count on my fingers how many common interview questions I got asked. None of them were like what I would read in the book and they would say that I would get. You just have to be prepared for anything, which I know sounds really daunting, but if you genuinely just go in with a general idea for all of the kind of most basic questions, you can work off that as well, but also just be yourself with it. Because the thing with interviews is everybody there has had a good personal statement or had a good UCAT or had a good BMAT. When you get to that point, you are fighting for yourself, if that makes sense. Like, you're not fighting to prove that you can do the exams because they know you can. They know that you're really clever. You're fighting to say that I are really passionate about what this is, and if you are and you just be yourself in the interviews, it genuinely does shine through. Like they can see that when you're talking, and they'd rather hear that, even if it's a little bit waffly, because I know some of my answers were and they were a little bit kind of all over the place. They'd rather hear a genuine, little bit unstructured answer than a memorized sheet of like, this is why I want to do this.
Good advice. Thank you. Georgie, tell us about this. What is it? Strategic applying?
Yeah, so I've coined this term. This is my term. But strategic applying for me, it's about lots of different things. So I'm not the most academically soaring student. Yes, I got the grades that you need to get into medical school. You can find them on the internet. Like, you know, I did well enough. But I knew that I needed to sort of really sit and plan. And something that I think is really strange, and I will never really understand, is when people apply to unis that do 4 different types of courses. Because I think what's really, really important to understand about medicine is it's not like, yeah, okay, we all end up with the same degree at the end and we can all go and, you know, do our foundation training, but it's not the same degree. Well, I mean, it is technically, but it's not the same process of learning the degree, right? So on one end, you've got Oxbridge, and you've got Cambridge and Oxford, and you've got the preclinical years. You're not going to see a patient. It's physiology, it's anatomy, it's pharmacology, it's all of, you know, it's biochemistry. That's what the course is. And then you have your clinical years, right? And then at the other end, you have PBL courses, and CBL courses, which you'd have to, you know, these are sort of phrases that you should definitely be researching and looking at, which are the other end of the spectrum. You're looking at specific patients and you're working a case through, and, you know, there's also, you know, and then you have somewhere like BSMS. And I think those places that I'm talking about that do case-based learning, I believe, well, actually, I don't want to get anything wrong, so I'm not going to. I have a couple of ideas of some unis I think do that, but I'm not going to tell anyone the wrong information. But BSMS, where we are, is in the middle, and that for me worked the best because I wanted to have lots of clinical exposure as early as possible, but I also really wanted the theory, and that's what we have in the course. And I applied to 4 unis that are, I mean, one of my unis definitely less so, but I applied to 4 unis that are like that. And it is so important that you are aware of that, because there's a lot of people who will apply, they want to go to Oxford or Cambridge, and they will end up not there because realistically, you know, that's pretty unlikely, you know, in terms of the percentage, and you need to be realistic about that. But then they end up at a uni because they've applied there and, you know, they've got in, that is nothing like the course that they want to do. And it's so important to understand that if you are going to medical school for the sake of going to medical school is not going to work out. You need to know that, you know, need to know how the course is structured and how it works and how you fit into that, rather than you need to match yourself to the uni rather than trying to force the uni to match you. And you know, sort of trying to think about that in year 11, 12, 13 is a really good idea, because it tells you what you want out of the course. And yeah, and then I've already banged on about the UCAT. That gets your foot in the door. That is a number on a piece of paper that means so much, and it is really hard. I mean, I did terribly at the UCAT, to be completely honest with you. I did get an interview at a UCAT uni, so I did well enough to get an interview. But even then, again, in terms of strategic applying, I chose UCAT unis that I thought would probably take me. There was no point going applying to a uni that needed a 3,000 score UCAT, because I didn't have a 3,000 score UCAT. So I kind of was like, and my UCAT wasn't close to that. So I was like, well, I'm not going to waste a place. And it's really, really important that you consider that. And also using your 5th choice. If you know, we mentioned earlier biomed. For me, that was not something that I wanted to do. Because also you have to sit the GAMSAT, which is another thing that if you're applying to graduate medicine, which is 4 years, you need to sit the GAMSAT, which is the UCAT but worse. And and yeah, so it's an incredibly difficult course to do, graduate med. But more to the point is that your fifth choice, if there is something that you are really interested in and you think, do you know what, actually I would quite like to do neuroscience if I didn't do medicine, use that choice, and use that choice in a uni that you would love to go to and that you could see yourself going to. I withdrew from my fifth choice because I kind of did it and realized that was a bit silly because I was never going to take it. But if you know that there is potentially a course that you would like to do as much, make sure that that fifth choice is, that is a strong one, is my advice as well.
I also
Such
think
good
like,
advice.
generally throughout the application process is just be really annoying. Like go up to your teachers, and because my parents aren't doctors, but my neighbour's a doctor. I was banging on her door going, oh, do you mind doing practice interviews with me? Can you read my personal statement? Can you, like, all of this kind of stuff? Ask your teachers. And that's to do with any part of the process, even A levels, because you need high grades for it. If you don't understand something, just go, just actually be really annoying, go to them at lunchtime and be like, oh, can you help me with this, or can you help me with that? Get your parents to do practice interview questions with you, even if it's embarrassing or that kind of thing. Like genuinely using the people around you. If you know a friend whose mate's sister goes to uni, ask for her Instagram and message her on Instagram and just say, like, what can you tell me about this? Because any advice you can get is helpful advice, even if you don't take it. It's just things to take in. And like there are people that are so willing to help you. Like any medical student I know would be very willing to help someone applying, because we know how annoying the application process is. So just like use the people around you as well, I would say.
That's very good advice. Thank you both.
Sorry, can I just add on the tiniest bit? Sorry, I hate to be annoying, but I just don't want to miss the opportunity. Talking about work experience in medicine is weird because nobody reads your personal statement, and I say that with quite a lot of with conviction. I know that obviously things are changing with the medicine application process, in terms of 2025 and 2026, but nobody reads your personal statement. So make sure that you are just getting things done in your personal statement. You don't need to spend 1,000 years doing it. But you do need to be able to have work experience to reference in an interview. That can be anything. And honestly, in terms of widening participation in medicine, they're really, really trying to make the playing field a lot more level, because the truth is, if your parents are doctors, it's easier to get work experience. So they're trying to make it much, much more fair. And the point is, and my work experience that I talked about in my interview was working front of house at a Jamaican restaurant that my boyfriend is a chef at, and also working in a shop. And I talked about how, you deal with people and difficult situations. And, sometimes you sort of have to, you need to before think about, okay, here's situations I've been in, and maybe sort of, you don't need to, no, obviously I'm not telling you to lie, but it's like you're trying to like make this a point of like, yes, this is a time that I really learned something incredible about this. And even if it was just kind of like the run of the mill day, you need to have examples that you can pick on in an interview when they've asked you something about that. But does it need to be medical? No. And you also need to check that with your uni, because I didn't see a single uni, as far as I'm aware, that is like, you have to have medical work experience, because they realize it's not fair. But it's also good to have work experience in the medical field to know that you actually want to do medicine, because I know a lot of people that did medical work experience and decided not to do it in the end. But also, if you know it's really, really what you want to do, and you think, I can't really get any work experience, or you've decided in year 13 that or the end of year 12, it would have to be end of year 12, that you want to do medicine, and you're like, I don't have time to sort out work experience, don't worry, just work for a week somewhere that will take you, and use some opportunities that things that you've done there.
That's such a good tip, because that's something that students really worry about, because as you know, most people can't go and shadow a doctor or something. I always say maybe try a care home for some volunteering experience, but it's great to know you can use any kind of person-to-person experience. That's really valuable. Thank you. We are going to overrun just a little bit, but I do want to ask you all just about managing stress, whether that's family expectations or the expectations of your own hopes and dreams. What tips do you have for people currently in sixth form about kind of managing that?
I'm so actually okay. I'll go.
Thank you.
Managing stress. managing stress. It's a difficult one, and I think that everyone struggles with managing stress. And I think that there's doctors that I've spoken, and obviously speaking from my own sort of perspective, but there's doctors I've spoken to who are still sort of like, I'm not really sure how I manage the stress, but you just sort of get through it. But the point is I'd say what the most important thing is to have a support network. I've been really lucky that I've had people that have been very invested and have known every stage of the process and really understood what I'm going through. Find somebody and communicate that to them. Get your parents to really understand. I mean, if that's your relationship is right, get your parents or a friend or your partner to really understand where you are, because having somebody celebrate you and support you will get you through the process. So I would say that, yeah, support network is vital.
Thank you. Who else has got some tips?
I'd say quite a similar thing, but also being able to kind of have things to look forward to, because I think it is a really long process, and A-levels themselves are a really long process, even just the exam period, not even the revision part of it. And it's a hard balance to know when to say, I'm too stressed that I'm not actually going to be able to do any productive work, versus, right, I do actually need to get something done because I've not reached what I need to reach for this exam, or whatever, that kind of thing. But being able to have, even if it's really small, it's like going on a walk with your friend, it's on the weekend, it's just little things that will keep you going. And having the people around you, again, is so important, because if you've got outside expectations, which can be really difficult, then you still know you, and you know what will kind of get you through. And if you've got people around you that will help you kind of uplift that and support that, finding things that make it easier and make you more excited about it is easier when you've got people around you that are also trying to do that for you.
Great, thank you. And what about our physiotherapist and our nurse? How do you manage the stress?
I think again it's just really similar. I think the application process can be stressful doing that alongside A-levels, but the most stressful period, like I think most people would agree, between year 12 and 13 is the exam season. Is you're like they're revising so much, and you've got kind of study leave, and it's important just to get out and get some fresh air and just don't study for like 5 hours, 6 hours straight.
That's
Take
important.
breaks.
Yeah, you're right, because I guess you all know there's a point where your brain reaches saturation and you're just not taking anything else in. Devanshi, what about you?
For me, what helps is just reminding myself that I am doing the best I can, and whatever is in my control, and just leaving the rest to the destiny, and just knowing that I am doing my best. I have done everything that I was supposed to do, and yeah, that helps me.
Exactly that. Exactly that. And don't take on anyone else's expectations. Just know that you're doing the best you can, and that's it. I'd love to just very quickly, before we see if there's any questions, just ask Andrew and David very quickly, because we are overrunning. What do you look for in an application? If they're still with us.
Oh, yeah, I'm still
yeah.
just trying to turn my video on. Sorry.
Thank you.
No drama. I've got, so when personal statements come in to the university, the personal statements themselves, I echo what Georgie said, to be honest. They're read by the admissions team. They're not read by the academics themselves or the course leaders in any way, shape or form. So they work off a matrix, which I've actually got in front of me, hopefully. So what we like to see on personal statements is, it's titled Evidence of Research into the Profession. So it's trying to get that knowledge of what you understand a paramedic to do for a day-to-day, or a diagnostic radiography or an OT, or whatever profession you're applying to. What's that job on a day-to-day basis from your understanding? And you're free to email. We've had students in the past that emailed the ambulance service and asked to speak to somebody. The ambulance service has team leaders that are more than happy to take the time out to talk to people that are that are trying to research and join the profession. So just to be able to sort of evidence something that you've looked into further than, obviously, I've seen paramedics work on TV and it looks really exciting. Do you know what I mean?
Yeah,
So that's really important. And then really, again, what the other guys have said, work experience is really good. If you haven't worked, then is there any areas of your personal life that you can sort of draw on, and thinking about skills that you might need, sort of communication skills or compassion skills that you might need as a paramedic? Is there any way in your personal life that you've evidenced that? And it's about, because we've got the personal statements, as a paramedic course, we also have an interview day, and we're looking for people that can sort of adapt their own experiences, because nobody has actually been a paramedic yet, into, you know, what you think we are looking for as sort of paramedic students. And there's no right or wrong answer. What we would look for and what we're impressed by is an articulate response that sort of encompasses experiences that you've gained. I would also, lastly, I'll probably say, I do read a couple of them myself once they've been filtered by the admissions team. We get a lot of emotive personal statements drawing on sort of the ambulance service does this or that, or I've been to a medical emergency and I was the one that did this or that or the other, that's great, but try and be as factual about it as you can. Again, because we're not looking at them sort of holistically as academics or as paramedics or anything, that you're better off putting your time and effort into something, into the nuts and bolts of everything. What have you done? How has that, you know, and what have you demonstrated when you've done whatever you've done, and how does that relate to being a paramedic? And that would be more the angle.
Great advice. Great advice. Thank you very much for that. And lastly, David.
I think it's quite similar to what most people have said. I think it's just conveying that passion in words, you know, in your personal statements. For instance, for diagnostic radiography, you should be able to show that you've researched about the course and you know the details about the course, a clear motivation why you want to study diagnostic radiography. It could be about the technology that fascinates you. It could be about contributing to patient care. So it's reflecting those in words and in passion. So you have an understanding about the role of a diagnostic radiographer, and you know the qualities of a diagnostic radiographer, you know the NHS values. You could also translate that into some of the qualities you have and how you've demonstrated them in your personal statement. So more or less, it's just harmonizing what everyone has said, but tailoring it to diagnostic radiography. I know some people, the experience we have is that some people use one personal statement for maybe 1, 2, 3 different kind of courses. And sometimes it doesn't work best that way. So what we want to see is that this is for diagnostic radiography, this is for paramedic science, this is for physiology, or which other course, and you tailor it to it, and you put all those information in one piece.
Brilliant advice. Thank you so much. Thank you so much to all of you. Esther, do we have any questions that we've left unanswered?
No, but there was good comments about the idea of working for the NHS and working in healthcare. So they're going to do some research. They were asking sort of where do they go to find out more information about careers in the NHS in general. Basically, anyone could contribute to that.
I would say, I mean, obviously there's websites. Actually, do you know what actually is quite what I've noticed, because I've been looking for a healthcare job for myself over summer, is actually looking on NHS jobs, because they have everything from entry level HCA jobs to consultant openings. So you kind of get a feel for what what options there are. And there is NHS jobs that you like. I think it is literally nhsjobs.com or something similar. And also talking to people. In medicine, you'll be chatting to someone and they've got some really niche random specialty, and it's like, cool, I now know that exists. So yeah, if you can, just try and talk to people, and like Elsie said, bother people if you want to know more.
Yeah, and I thought it was great that Andrew said that, you can just kind of even ring up the institution that, and say, tell me about it, and both Andrew and David and all of you guys kind of made the point, do your research. I think that's the most important thing, that you absolutely understand what you're going into. I know from somebody very senior at one of the very top universities that they said if someone's applying for medical school and they say, I've wanted to do this all my life, it goes in the bin. Because they're like, no, you haven't. You didn't want to be a doctor when you were 2. They want to understand that you genuinely understand the job and the nuts and bolts of what you're doing. Guys, thank you so much. We have really overrun, but it's been so interesting. And I just know it's going to be so helpful for our students. And this recording will go to other schools. They've got open days today and they were really upset that their students were missing out. So thank you so much. I'll leave it to Esther to wrap up.
No, amazing. Thank you so much for all your help and joining us today, and everyone that's joined us and the questions that we've had. And yeah, hopefully we'll do another one soon. But anyway, have a good evening. Bye.
Thank you, guys.
Bye.
Thank you. Bye-bye.